This morning we are going to learn about robotic-assisted surgery, and the term here that I want to be sure that we emphasize is assisted. And joining us, two surgeons who are using these robotic machines. First of all, from Logan Health, we have Dr. Derek Berglund.
Yeah, thanks for having us.
Yeah, good morning.
And urologic surgeon. Urologic?
Yes.
Yeah, urology. There we go. I can get that. Dr. Vassilis Siomos.
Yes,
Did
thank
I get
you.
that right?
Yes.
Oh, terrific. And we also brought the person who kind of keeps you guys straight, too.
Good
morning.
Good to have you with us.
Yeah.
I guess the first thing we better do is set the table here so folks can understand exactly what is robotic-assisted surgery.
Sure. I usually tell patients that robotic-assisted surgery is basically just a tool that we use in the operating room to allow us to do complex procedures through very small incisions. In the field of general surgery, there's literally a robot in the room that gets docked on the patient, and it's controlled by a console that's in the room from the surgeon. And so it's kind of an extension of our own movements, and it allows us to do very fine-tuned movements within the abdomen.
Now, when we think of robots, we think of Robbie the robot, in old movies and stuff, but this is really just an arm or something that does the surgery that...
Correct. There's actually 4 arms on the robot that we primarily use, and each arm has an instrument at the end, and there's different instruments that we use to do different types of procedures and techniques.
Now, one of the advantages is steadier than the human hand?
Correct. Yeah,
Uh-huh.
it steadies our movements. So if we've had too much coffee in the morning, it can help compensate for that.
So now, what types of procedures can you do with this that is so much better than, I guess, opening a person up?
Sure. I guess I can kind of speak from the general surgery side, and Dr. Siomos can speak from the urologic side. But many of the procedures that we used to need to do through large incisions, we can now do through small incisions, complex procedures. And that really allows patients to have a quicker recovery and a shorter stay in the hospital.
So it's the incision that, healing the incision, it takes more time than the work you did inside?
Correct.
Wow.
Yeah. And it's really cut down on surgical site infections. Patients are able to go home quicker. They don't need as much pain medication because a lot of the incisions we're working with are smaller than the width of your finger. And we're able to fit a camera through one of those ports and then working instruments. And if you rotate your wrist, you can mimic that on the inside, which allows you to sew, remove tumors, sew everything back up. And patients often go home same day, the next day, where in years past, patients were staying in the hospital for weeks at a time.
Now, I know in the past I've had surgeons say the minimal amount of time that they had to have you open was ideal in the doing it the traditional way. But with the incision so small, it's probably very minuscule, huh?
Correct. And with these larger incisions that we used to make, patients would lose a lot of fluid. And so you'd spend before surgery, after surgery, balancing these different fluid changes. But with these smaller incisions, you're able to actually zoom in, visualize things better, and it really makes the recovery a lot faster.
So how long did it take you to learn how to use this thing?
During surgical training, I did 6 years of specialty surgery. Dr. Berglund.
Yeah, I had 5 years of residency and then 1 year of fellowship. And I think that we, started implementing robotic training probably our second year of residency.
Really?
And by the time I was in fellowship, there was a greater focus on robotic surgery. I did a minimally invasive surgery fellowship, and so we had a pretty good deal of robotics during that training time.
I'm just dying to ask you guys where all this started for you. At what point did you decide you wanted to be a doctor?
Oh man, yeah, that's an interesting question. My father actually is a colorectal surgeon here in town, and so I think I kind of followed in his footsteps. I've got a few other family members that did some shadowing in college, and then I think the interest just grew from there. It's a good chance to help people and to do something with my hands, and
So where did you have to go to med school?
I went to med school in St. Louis.
Now,
St.
we don't
Louis
have a
University.
med school in Montana, do we?
I don't believe we do. I think North Dakota and South Dakota have med schools, but I'm not aware of one in Montana.
So you had to go out of state.
Correct.
Yeah.
Yep.
And why surgery?
I think that surgery is a very tangible way to help people. Most people that come into a surgical clinic have a problem that you can fix with surgery, and I kind of like that tangibility to my practice.
How about you, Dr. Siomos?
So I wanted to work in a field where I could help people. I really like science. My family was involved in the restaurant business, so I liked working with people, talking with them. And I worked with a really great mentor in medical school who taught me a lot, challenged me, and gave me the ability to help people. And I said, I kind of want to do what you do. And it's just something that I fell into. It's kind of like having a good math teacher, and all of a sudden you like math. And the nice thing about working in medicine is the team approach to taking care of patients. And the robotic surgery program started in the Valley around 2010. And there's a huge backstory, excuse me, on how this all started. But I think we've done about 9,000 cases here in the Valley. And working with the first assists, such as Kim Ring. I know there was someone named Cheryl Ash who really started that program, but so many other people in the hospital really worked to make this a really successful program.
Well, Kim, you jump in here and tell us about your role in all of this. I need to get right close to the mic.
Okay. So we built a foundation by creating like very straightforward black and white protocols or whatever, and then we just build on that. So what we do is we are trying to make robotic surgery smooth. So when we started, it was more, and over time we've just gotten faster and better at it. So I was going to say too that even laparoscopic surgery, these surgeons can do complicated disease easier with the robot than they can even laparoscopic. So even if they can do it laparoscopically, sometimes they choose to use the robot because of the disease. And it just makes it easier for them to do that.
Now, are you able to target minute, really focused areas? Is this a little bit like radiology or something where you can target?
Correct. So the nice thing about the optics is that you can zoom in and out in areas that would be very difficult to see with just the naked eye. And the way things are moving is you'll be able to take a CT scan and actually onlay it into the surgical field, for example, like a kidney tumor. And whenever you change the angle of the camera, it also changes the CT scan. So you can actually superimpose those images onto the surgical field. Which is just a fascinating way to approach cancer and kidney tumors, liver tumors, and other sorts of things in the body.
Talk to us about the kinds of procedures you're able to do. I want to start with you, Dr. Siomos, because you're a urologist. What are you able to do in your field?
Correct. So my focus is on the urinary tract. So a lot of kidney surgery, prostate, ureter, bladder surgery, and using the robot, I'm able to get to places in the body that are often difficult to do with larger incisions. So you can focus on small kidney tumors, small tumors in the prostate and the bladder.
Somebody once told me that if we men live long enough, we're going to get prostate cancer. Is that true?
Yes. About 70% of men at the age of 70 have some form of prostate cancer. Now, most of it is low grade, but now with better imaging, laboratory testing, we're able to find patients who need interventions earlier in life so that when they live to 90 and 100, they're able to enjoy their lives.
How difficult is that surgery now that you've got the robotics?
It's made it a lot easier, and you're able to actually see what you're doing. With open prostate surgery, for example, a lot of that surgery is done by feel. And now with robotics, you're able to spare nerves, you're able to sew more delicately, and patients are recovering a lot faster.
Wow. That is awfully good news, because a lot of men are having to deal with that, I would imagine. And so, Dr. Berglund, what types of procedures do you do mostly?
Sure. So I'm a general surgeon by trade. I did my fellowship training in minimally invasive surgery. But primarily at Logan, I have a pretty big focus on hernia surgery and complex abdominal wall reconstruction. I also do some foregut surgery as well. So those are things like hiatal hernias, paraesophageal hernias, diseases of the esophagus, that sort of thing.
How do we get these hernias? How does that happen?
Sure. So when I'm talking to patients, usually they present with something like a lump, and I think a common misconception is that the lump itself is the hernia, but a hernia is basically just a defect in the strength layer of the abdominal wall. And so kind of the concepts behind surgery for hernias involves closing the defect and then reinforcing that defect, often with something like mesh. And the robot really helps facilitate that by allowing me to work in a small space and really limit the size of the incision that's required to do that.
How do patients respond when you say, we're going to use a robot?
Most of the patients are fascinated by it. They want to see pictures. Some patients are engineers or have a mechanical background and want to know how the robot actually works. I refer them to the Da Vinci website. There are YouTube videos looking at different surgeries. Some patients will say, you know what, I'll look at it after the surgery. But a lot of the patients are just really interested in how we do the surgery and how it all comes together.
Now, this is the Da Vinci robotics that we're talking about. You have your hands in some sort of gloves type thing, don't you?
They almost look like little thimbles that you kind of fit your fingers into. And once you fit it's usually index and thumb, or index and middle finger, and when you rotate your wrist, when you're in that, it actually rotates the instrument that you're using.
Oh. How small are these instruments?
Yeah, the robotic instruments, the arms themselves are pretty long, but a lot of the movement of the arm happens outside of the patient. And so inside the patient, each instrument is maybe only a few centimeters long. But one of the unique things about the robotic instruments is that you can open and close the jaws of the instruments, but you can also articulate them at the wrists. And so it gives you a lot more mobility inside of a small space.
And so I would imagine you've got a degree of magnification going on so you can watch all this.
Correct, yeah. And you can control some of the zoom within the robotic console. One of the really cool things about the console that we use is that it's a binocular camera. And so even though we're looking through a viewfinder, it's a three-dimensional image that we're seeing as the surgeon, and that really helps our depth perception when we're operating.
I would imagine it must have taken you years of practice and training to get this down.
Yeah, they always talk about surgery as being a lifelong learning type of deal, and so we're continually adopting new practices and trying to kind of refine our techniques so that patients do better. And so, yes, it's taken a lot of years of training to get here, but it's important that we as surgeons continue the learning process so that we can take care of patients.
Well, Kim, you said we had the first robot here, in 2010, so that's like 15 years ago. How many of these machines do we have now?
I think we have 4 in the valley.
Okay.
Yeah.
And are they all at Logan Health?
So 3 at Logan Health in Kalispell and 1 in Whitefish.
All right. And so the development of these machines over the last 15 years, I would imagine there's been some upgrades along the way.
Oh, yeah. And that's what helps I was talking about the case going smoother. It does help make the case go smoother. To have Intuitive is also helping with the team to work together so that it's less learning for each individual in the room as well.
Now, when you say upgrades, is it the hardware or is software upgraded?
They are doing both.
Oh, okay.
So how much different is the one you're using today from the one you first used in med school?
Very different.
Really?
Yeah. The visualization's better. The different instruments that we use operate a lot differently. And now with the most recent version, you're actually able to get more tactile feedback, more data collection, so you can look back and see how much tension you put on a certain part of the body in terms of the tissue at a certain part of the surgery and review it and see what you were doing 10 cases ago. And it really, as Dr. Berglund was mentioning, really allows us to continue to improve what we're doing.
As far as the evolving technology goes, John and I, come in each day and sometimes the computer updates, and we have to deal with that. You don't have to deal with that regarding the robotic surgery. I wondered about that if you have an IT department or somebody special that maintains the equipment.
Intuitive has an engineer that is on call, and he can come if we ever need him. But it does update on itself. Like they'll tell me this robot needs updated, and so then I update it.
But as far as features go, you guys are given a heads up and have an ability to test it and work with it before you actually utilize it in surgery. Now, what as far as the evolving technology goes, I guess this would make you a seer of sorts. What do you think is coming?
Yeah, I think Logan Health recently purchased the newest iteration of the Da Vinci robot from Intuitive, and we've been using that now for several months. And the new version of the robot is called the DV5. Really allows for expansion of technology. It has somewhere along the line of 10,000 times the computing power of the previous version.
Wow.
And so there's a lot of capability for expansion and newer features. And so Dr. Siomos was alluding to one of the new features is force feedback, and that's something that we're going to be implementing pretty soon. It's another kind of safety feature. For the older versions of the robot, when you're in the console, you really can't feel tension. You don't have any tactile feedback. And so as a surgeon, you sort of learn to feel with your eyes, as we say. And we rely on visual cues to know what sort of tension we're putting on tissue. But with this new technology, we should be able to actually feel the force that we're applying. And there's a lot of data acquisition that can come from that so that we can improve outcomes.
So you feel the force, but you would also have some sort of a digital readout of what happened and be able to relate it with past cases and really fine-tune what you do.
Correct. Yeah, and so it's more of a mathematical approach to it in terms of data collection. Is when you use your instrument to hold some tissue up, you can actually get a numeric printout of how much pressure, tension, Newton's force, all that kind of stuff that you're using. So at the next case, you can say, oh, did I really need to use this amount of force? Maybe I can use a lower amount and see if that improves recovery outcomes, things like that.
And you can compare that and perfect your craft.
Correct.
That's neat.
So given the number of procedures you're able to do right now with the Da Vinci, what do you see as the possibility for expansion into more procedures?
Yeah, that's one of the things that we try to focus on. We have a robotics steering committee at Logan where we look at how the robot's being utilized across all of our specialties, and we really try to fine-tune it to improve access to patients because we want to have the robot available for patients so that they can get the best version of the surgery that they need. And that's really one of the goals we're trying to focus on. Is
open heart something that may eventually be robotic?
There are plenty of robotic surgeries that are done by the vascular CT surgeons. And even ear, nose, and throat surgeons are able to access parts that they need. And so this is why it's spread across a lot of fields between oncology, general surgery, gynecology, ENT, thoracic, are all able to use this remarkable technology to access really small parts of the body and do these complex operations with small incisions.
The reason I ask about open heart, obviously, because that is a major intrusion into the body, splitting the rib cage and everything. If there was a way to do that without having to invade the body quite like that, wouldn't that be something?
Yeah, that'd be pretty remarkable.
Yeah.
Yeah.
And this is where this is going, I sense.
Yeah, I think the sky's the limit. The technology is advancing very rapidly, and there's changes all the time. If you speak with, the robotic companies and the representatives, it sounds like they have thousands of ideas that are kind of coming through their pipeline, and they can only work on so many at a time. But it is evolving very rapidly, and I'm interested to see where it goes in the future.
Wow. Guys, this has just been a fascinating conversation, and we really do appreciate the work that you're doing and the effort that you have put into learning this new technology and the benefit for the rest of us here. Thank you so much.
Thank you for having us.
Thanks for having us.